As a practicing migraine expert for the last 20 years, I have observed two type of people who are having migraine. One type of people cries when they have pain. That is, pain will lead them to crying. And another type of people, they will have crying followed by migraines. That if they cry for 10 seconds also, suddenly the headache will start. The person who is having both these symptoms, those who are having emotional issues and they are crying over it and they are getting headache after that, and also those people who are having migraine and crying due to that, these people have to be taken into very seriously. Because if you have such emotional issues, if you tell to a neurologist or if you tell to a modern medicine doctor, they usually prescribe you anti-anxiety medicines or maybe a slight sedatives or maybe an antidepressive medicines may be prescribed for you. But most of the people, those who are having emotional issues, don't require psychiatric medicines. That is what we have to understand. First of all, the case has to be dealt in detail. That is why in our hospital we take into consideration both these three things, like physical, emotional and psychological problems have to be taken care of before we prescribe a medicine to the patient. This is the reason why you are not better with many painkillers or many prescriptions which is over the counter, or many of the doctors have prescribed so many medicines for you and you are not feeling better. So when we take up the case as a holistic manner, that is psychological, physical and emotional problems into consideration, and then we prescribe a medicine, that will give you an instant relief as well as a permanent cure for the case of migraine. So if you are looking for a lasting cure instead of an instant relief, please understand that this case has to be looked into in a holistic manner, so that the psychosomatic illness or the illness which is coming from the mind or the psychological issues should be taken into consideration and it can be permanently cured.